Renal anatomy, structural correlates of function. The kidneys, paired retroperitoneal organs, are fundamental to homeostatic regulation. Their gross anatomical features and intricate microstructures are precisely adapted for their primary functions of filtration, reabsorption, and secretion. Macroscopic anatomy. Encapsulated by a protective adipose layer and dense connective tissue, the kidneys exhibit a characteristic reniform morphology. The renal hilum, a medial concavity, serves as a conduit for the renal vasculature, ureter, and nerves. Microscopic anatomy. The parenchyma is organized into two distinct regions, the cortex and the medulla. The renal cortex, the outer layer, houses renal corpuscles, the initial filtration units. The renal medulla, the inner layer, is comprised of renal pyramids, which contain the loops of Henle and collecting ducts. Renal columns, cortical extensions, separate these pyramids. The nephron, the functional unit, is a cornerstone of renal physiology. It consists of the renal corpuscle, encompassing the glomerulus and Bowman's capsule. The renal tubule, subdivided into proximal convoluted tubule, loop of Henle, distal convoluted tubule, and collecting duct point 1. The renal pelvis collects urine from the calyces and funnels it to the ureter. Renal physiology, mechanisms of homeostatic regulation. The kidneys maintain systemic homeostasis by regulating fluid and electrolyte balance, eliminating metabolic waste products, and modulating blood pressure. Glomerular filtration. Afferent arterioles deliver blood to the glomerulus, where hydrostatic pressure drives ultrafiltration across the glomerular filtration barrier. The filtrate, a protein-free plasma derivative, enters Bowman's capsule. Tubular reabsorption. As the filtrate traverses a renal tubule, selective reabsorption of essential solutes, dissolved substances, glucose, amino acid, electrolytes, and water occurs via transcellular and paracellular pathways. This process is hormonally regulated, notably by aldosterone, an antidiuretic hormone. Tubular secretion. Active transport mechanisms facilitate the secretion of specific solutes, e.g., hydrogen ions, potassium ions, organic acids, from the peritubular capillaries into the tubular lumen. This process augments the elimination of waste products and contributes to acid-base balance. Urine formation and excretion. The residual fluid and solutes within the collecting ducts constitute urine, which flows through the renal pelvis, ureters, and bladder for excretion. Renal regulation of blood pressure, a multifaceted system. The kidneys exert significant control over blood pressure through several integrated mechanisms. Renin-angiotensin-aldosterone system. Juxtaglomerular cells release renin in response to decreased renal perfusion pressure. The RAS cascade culminates in the generation of angiotensin II, a potent vasoconstrictor, and aldosterone, which promotes sodium and water retention, fluid and electrolyte balance. The kidneys regulate blood volume by modulating water reabsorption, thereby influencing blood pressure. Electrolyte homeostasis, particularly sodium balance, is critical for blood pressure control. Vasoactive substance production. The kidneys synthesize and release vasoactive substances, including prostaglandins and nitric oxide, which contribute to local and systemic vascular tone regulation. Neonatal renal physiology, developmental considerations. Neonatal kidneys exhibit functional immaturity, necessitating careful clinical consideration. Reduced glomerular filtration rate. Neonatal GFR is significantly lower than adult values, reflecting incomplete nephrogenesis and reduced glomerular capillary surface area. Limited urinary concentrating ability. Neonatal tubules exhibit diminished responsiveness to ADH, resulting in decreased urinary concentrating capacity and increased susceptibility to dehydration. Developmental trajectory. Renal function progressively matures during the first year of life, with full functional capacity typically achieved by 2 years of age. Blood pressure regulation. Neonatal blood pressure is lower than adult blood pressure,